Welcome and good morning, everyone. My name is Wendy Peterson, and I'm the director of the Senior Services Coalition of Alameda County. And on behalf of our coalition's member organizations, it's my great pleasure to welcome you all here today. Before we get started, let's thank the people who made today possible. First, a huge thank you to our core sponsors, Center for Elders Independence and the CEI Foundation, Alameda Alliance for Health, and Kaiser Permanente. These sponsors not only provided financial support, they have worked with us to help put this conference together, and we really appreciate that. We appreciate all of our sponsors' generous support. Without you, this convening would not have been possible. And I want to thank all of you here today in the audience for being here, to lean into the important discussions we're about to have. I'm especially glad to see so many community members, including stakeholders from the villages, from United Seniors of Oakland and Alameda County, from St. Mary's Center. We couldn't talk about improving health and life outcomes for older people without your voices at the table. So today, please use the chat to ask questions, to call us on wonky acronyms, and to tell us about what really matters to you and your family and your neighbors. We really need to hear from you, and we'll be capturing all of your questions and comments for the conference proceedings. So this is the 9th conference that Senior Services Coalition has done, and each year we've used the convening to bring our community of stakeholders together to talk about how we can make a difference in the lives of older adults in Alameda County. Today's focus, striving for equity at the intersection of health, housing, and aging in community, is an issue of increasing urgency. Just yesterday, California Healthcare Foundation released a poll that shows that Californians are acutely aware at a personal level of our health system's weaknesses serving older adults and others with chronic illnesses or disabilities. The poll reports that 44% of Californians say they are not confident that they will have the financial resources to pay for home-based support that might be needed by their family members or themselves as they get older. That concern is much more pronounced among Black Californians at 52% and among people with low incomes at 56%. This year, Medi-Cal has increased its focus on people who are in nursing homes or are at risk of being institutionalized. And locally, a host of community supports are coming online. While Medi-Cal is not an option for many older adults whose incomes are low, this new initiative represents a tremendous shift in the health systems, and it's an opportunity that we are wise to engage with. How might the previously siloed systems of medical and healthcare services walk hand in hand with community-based service providers to improve access to alternatives that help older people live in community and avoid institutionalization? Today, with our keynote conversations and panels, we'll be hearing from people who are striving to answer this question, to understand the potential of Medi-Cal's CALIM initiative.
I'm sorry, Wendy, your slide is your background.
Okay. Thank you.
Sure.
There we go. Okay. So our keynote conversation and panelists, will be hearing from them. They'll be answering this question. They're working to understand the potential in Medi-Cal's CALIM initiative to change the trajectory for at-risk older adults and to advance equity for older people in economic security, healthcare, housing, and supports. To ground us, I'm going to share some data to help us think about Alameda County's older population and set the stage for what we're going to talk about today. In Alameda County, there are currently over 230,000 people age 65 or older. And older adults are the fastest growing segment of the population. And in just 7 years, 1 in 4 county residents will be age 60 or older. With that increase, the number of people with Alzheimer's disease or related dementias is expected to grow, tripling over the next 40 years, with implications for healthcare and social support systems and for our community, implications that must drive decision-making and action now. Economic insecurity is a reality for a growing number of older people in the county. Over 83,000 older adults were living at or below the elder index, a measure of what it costs to pay for very basic needs. Of these, over half have Medi-Cal health coverage, but for many of modest income who aren't eligible for Medi-Cal, out-of-pocket costs are unaffordable, and Medicare doesn't cover long-term care services like adult daycare and in-home care. Where you live determines so much. This map is familiar to many of us who know the historic patterns of discrimination marked by redlining. In some areas, large portions of people age 65 and older live in poverty. In the deepest blue areas of this map, the portion of older adults in poverty is over 30%. About 22% of older adults live alone in our county, a situation that puts many at increased risk of social isolation and poor health outcomes. Well over half of people age 65 or older are renters. About 30% own their homes. Over 10,000 people live in residential care facilities like assisted living and board and cares. And about 4,000 people reside in skilled nursing facilities. Of older renters, about half are housing cost burdened, and about 15% spend over half their income on housing. For both renters and homeowners, financial, medical, or other emergencies later in life can push those who are already struggling to make ends meet into homelessness. Alameda County's 2022 point-in-time count indicates that 19% of the homeless population are age 60 or older, a significant increase over the last count. While not everyone with a disability has challenges with living independently, older adults age 75 or older in our county, 29% of them have an independent living difficulty, meaning that they encounter challenges performing instrumental activities of daily living, such as grocery shopping, cooking, managing medications, and paying bills. When we look at the emergency departments in Alameda County for some insight into how older adults are doing, we find that a large portion of the visits to ERs by people age 65 or older are either preventable or unnecessary. And a large percentage of older adults visiting ERs have functional deficits, meaning they have difficulty with self-care, like bathing and grooming. An even larger percentage have both functional and cognitive deficits. Today, you'll hear about how increased visits to ERs often indicate that an older person is on a path to increased hospitalizations or institutionalization, and how community supports can intervene to change that trajectory. So let's look again at economic insecurity. Alameda County is the 7th most diverse county in the nation. This chart is not a picture of how many people, it is a picture of economic disparities. It shows the percentage of older people by race and ethnicity in our county who have incomes below the federal poverty level. Over 22% of older Native Americans in our county, almost 16% of Black and African American elders, over 12% of Asian elders. The rates for these groups are significantly higher than the average rate of poverty among people age 65 or older. So how do we address inequities that may limit access to home and support? How can we embrace the emerging opportunities that exist today to change the trajectory that leads too many older people to unnecessary institutionalization? Today, we're not going to answer those questions, but we are going to begin a dialogue to address them.